Bismillahirrahmanirrahim. Today we are going to start the chapter on musculoskeletal conditions. Today we are going to look at the different musculoskeletal changes that we see in the life of a human being. And basically we are going to study the changes from birth till adult life. Now we are going to divide these changes into two categories, or you can see we will see these changes in two aspects. One is the muscular system and the other is the skeletal system. In certain stages, we are going to see these two systems separately, and in the other stages, we are going to evaluate these two systems simultaneously. So let's start with these systems, and we look at these systems in the first year of life in a human being. Now let's see the age group between 1 to 6 months of age, and let's see how does this musculoskeletal system evolve and what are the changes we see as the days go by. First of all, we look at the skeletal muscles. What we see now, what I want is you should imagine a baby, and as the baby progresses through the ages, through the years, uh, we will see what changes are there and how does a baby evolve into a child and that child evolves into a young adult. So keeping a baby in mind, let's look at these changes. Skeletal muscles. Now the baby is 1 to 6 months of age. What we are going to see is that the muscle fibers, they will grow by multiplying, and the muscle length, that will increase. And as the muscle grows in size, more cytoplasm is collected within the muscular cells. So basically, at this stage, it is not exactly the number of fibers which are growing, it is the amount of cytoplasm which is increasing within these fibers. Now we move on to the cardiac muscle. Now the cardiac muscle, the obviously as the baby grows, as the workload on the body of the baby gradually increases, the cardiac muscle also increases in size. It increases in size by enlarging the myocardial fibers, the myocardial muscle fibers which compose of the heart. And not only the size of these muscular fibers increases, uh, the number of these muscular fiber also increases. So you will see hyperplasia there. So with this mechanism, as the child starts to grow, the cardiac muscles, they also start to grow with the growing child to meet the demands of that child. Now the facial muscles. Now the muscles of the face and respiration, gradually after birth, they also develop. If you look at the child just after birth, you will see that a child might be very wrinkled, and even some children, you might say, they resemble, I mean, we call them fetal faces. They do not resemble a normal baby. But as days goes by, you will see after a week, after 4 5 days, usually after a week, all those wrinklings or that face is going to change, and it will change into a baby face from a fetal face. And the changes with your the respiration, those also take place as soon as the baby is born, because when in fetal life the lungs are collapsed, as soon as the baby is born, he takes in a deep breath and the lungs expand. Then the respiration from the mother is after birth it is converted to the baby, because now it is out of the womb. The mother cannot take care of the baby's survival. The baby has to survive itself. So the lungs, they expand and they take over the respiration, the respiratory system. Now, if we look at the posture and the development of the muscles which are related to the posture, what we are going to see is in the second month, when a baby is 2 months old, what you will see is there is going to be a decrease in flexion and an increase in the extension of the limbs, and there is going to be some asymmetry. What if you see a newborn, usually in the first month, what you see is that the baby, usually his arms and his legs, they are flexed towards the body. It The baby usually does not extend out his limbs. Usually they are in close approximation to the body. They are flexed. But as the baby grows, you will see that this flexion, this will start reducing, and extend, I mean, you will see that the baby will start extending out its limbs, but this takes about 1 to 2 months. Gradually the flexion, it starts disappearing, and the baby freely starts to extend out its limbs. By the third month, you will see that there is going to be some symmetry in the movement of these limbs. The extension of these limbs, it is going to be more symmetrical as compared to the when it was as compared to the second month. And the by this time, by the third month, the baby is able to hold up its neck, because initially in the first 2 months, always when we pick up the baby, we have to support the head of the baby. Why? Because the neck muscles, they are not strong enough to take the weight of the head. But as these neck muscles develop, as they gain strength, so by the third month, the baby is able to hold up his head, because now the neck muscles, they are strong enough that they can take the weight of the head. And the if you look at by 6 months, the baby is able to extend his neck against gravity. Babies who are younger than 6 months, you will frequently see they are able to hold up their necks, but after some time, the head just drops to the chest. It just goes like that. That is because till then the neck muscles are not that strong. They are able to hold up the head for a small period of time, but they can't do it for a long period of time. But by 6 months, these neck muscles have become so strong that the baby is able to extend, even look back, and hold up his head without any problems. Then he has a very good control over his head. He can extend his head, he can flex his head. The head does not fall back or to the sides due to gravity. Now we look at 7 to 12 months of age group. By the time the baby is 7 months old, the baby can pivot around. By that we mean that the upper limbs, the baby is able to move his upper limbs in a round fashion. Because initially, if you look at a very young baby who is about 6 months or less than 6 months, they are not able to rotate. Pivot means to rotate their upper limbs through all the angles. But as the baby grows, the baby is able to pivot around in a symmetrical manner his upper extremities. By 8 months, the baby starts to crawl, he becomes mobile. So, roughly on an average, some babies are very fast, they reach these milestones very, very quickly, but we are talking about an average baby. By 8 months, a baby is crawling, he is very much mobile, he can move around the house. Even these crawling babies, they can even climb up the stairs or come down the stairs. So the baby becomes mobile around 8 months. By the time baby is 12 months old, that baby will be able to stand on his legs. And most of the babies, they not only stand on their feet, they even start walking by the time they are 12 months old. So again, 1 year is an estimated time where an average baby starts to walk. So what happens is, by 12 months, the baby, he assumes a linear apposition. That means he can stand in a straight line. He is able to support his body in a linear fashion. Now we come to the age group between 1 to 6 years of age. And first of all, we are going to look at the muscular changes. Now, between the age group 1 to 3, let's look at the skeletal muscles. Between 1 to 3 years of age, what you are going to see that the strength of the skeletal muscles, that will increase, especially of the trunk and the lower extremities, because this is the age group by which time the baby, he starts to walk properly, he starts to run properly, and he becomes very, very active. And this is the time when the baby, he has acquired a good balance. So he is running around, he is walking around, and he can do a lot of activities. So, but to do that, what happens is, the things that ensure that baby is able to do all those things, it is the increase in the strength of the trunk and the muscles of the lower extremities. Now, if we look at the cardiac muscle at this age group, obviously the baby has grown, there is going to be more workload on the heart. So what does the heart do? The left ventricle, it starts to grow at a more rapid pace as compared to the right ventricle. Now the heart is assuming the uh, the shape of the adult heart, because if you look at the heart, all the chambers, they are not symmetrical, they are not of equal size. The left ventricle, it is the largest and the strongest chamber of the heart, because it has to pump blood to the whole of the body. So this is the time when the heart starts to grow and it starts assuming the shape and the molding of a adult heart. So as the workload starts to increase, as the child grows, the left heart, it starts to grow at a faster pace as compared to the right heart. Now the sphincter muscles, again, if you remember, if you have children in your house, if you're not, I mean, you must be interacting with little kids. This is the age group when we start to toilet train these kids. That is because this is the age when these children can control their sphincters. The muscles have developed so much that now they are able to control the sphincters. So that is why this is the age between 1 to 3 that we start toilet training our kids, because now they can assume sphincter control. Then if we look at the posture patterns due to this muscular development, now the thing is, the child has stood up. The child is standing. Now all the weight is on his legs and on his hips. But because this is a brand new experience for the child, you will initially, what you are going to observe is that these children, these smaller kids, usually they have a relatively bow-legged appearance, which gradually disappears. But initially, they have a bow-legged appearance. But as they grow up, this thing corrects itself. Also, you will see there's that these children, initially when this child starts to stand up, they have flat feet, what we call a flat foot. But as the child gradually starts to walk, then the foot arch, which you see, that starts to form. So all this starts to happen between 1 to 3 years, when the child has started walking and running around. By the age of 2 years, what you are going to see is that the child has now developed a mature grasp. That means he can easily, with accuracy, he can grab different things. If you look at a small baby like 9 months, 10 months, even 7 months, if you give him something, he will lunge for it. He will just try to grab it. There is going to be no precision in it. But by the age of 2 years, if you're going to give something to the child, he won't miss it. His coordination will be there and he will very accurately grab that thing which you are giving him or what he is trying to grasp. So these things, as the child grows, these patterns keep on developing. Now we come to the 4 to 6 years of age group. Here what you are going to see is that the creatinine content in urine, it starts to increase. Why? Because as the child is growing, his muscle mass is increasing. And you know, muscle mass is protein. A lot of metabolism is going on because in growing children, the metabolism is very fast. So as a lot of metabolism is going on and these muscle, basically muscle is made up of proteins, the wear and tear and the breakaway and the breakdown that is happening in these muscles, in these proteins, they give rise to the formation of creatinine, because creatinine is a byproduct of protein metabolism. So as the child is growing, as the muscle mass is forming, more metabolism of protein is going on. By the years between 4 to 6, we will see that the creatinine level in the urine of these children, it will start to rise. Please mind you, by saying it will start to rise, it does not mean that it is going to be above the normal range. We just see it is going to be within normal range, but in a smaller child, in a newborn child or a few months old child, the creatinine levels in urine are very, very small. They are very, very little. But these will, this is a relative term. We are comparing these creatinine levels with children who are less than 4 years of age. So as we compare them, we will see that the creatinine level in children who are reaching the ages between 4 to 6, it will gradually rise due to an increase in muscle mass, because more protein is being metabolized and it is being converted into muscle. Now the muscle fibers in these cases, they will start increasing in diameter and their strength will further increase. And as the strength increases, the child's mobility, his actions, his activities, all of these things are also going to increase. Now it is seen that this is the stage when there is a growth spurt. That means this is the stage when suddenly the child, his height suddenly increases. Height is increasing, but it is a gradual process. But this is 4 to 6 years is the age group where you will see the first spurts of height gain. And when this height gain occurs, these children might feel some growing pains because suddenly the muscles are growing, suddenly the bones are growing. And due to this, what we are going to see, yes, sometimes these children, they experience growth pains. Now, let's see, those were the muscular changes. Let's see the skeletal changes that occur between ages 1 to 6 years. Now, first, we'll see what happens between 1 to 3 years. If we look at the spine and the extremities, 1 to 3 years, leg growth. Suddenly, the baby starts to grow. His legs suddenly start to increase in length, and during these years you will see that the baby usually gains a height of roughly 5 inches in the second year and around 2 inches in the third year. This is an average increase. I mean, it might be less than that, it might be more than that. Again, this is going to depend on his genes, his family, and the other factors. But this is a rough estimate. This is an approximation and average, that an average child usually gains a height of around 5 inches in the second year and around 2 inches in the third year. Now, uh, by the year 2, by the time a child is, we sometimes see it in 1.5 years, but definitely by 2 years, all the bones of the skull, they have ossified. There are no fontanelli seen, neither the anterior fontanelli, neither the posterior fontanelli. All the bones of the skull, they are fused by 2 years. And the teeth, by 6 months of age, what you see, the child starts to erupt his first teeth. They are the primary teeth which come out. And as the months go by, gradually the rest of the teeth, they follow. Now, if you look at the skeletal alignment of these children between 1 to 3 years of age, I've already told you, because they have started getting up, and there is, again, this is a new process for them, because either a newborn is lying down or they have been crawling on all four limbs. So when they start getting up, initially the muscles are weak and there is pressure over the bones. So these children, if you look at a small child who has just started walking around 1 year, 1.5 year, or 9 months, 10 months, you will see that they will keep their feet apart and they will be relatively bow-legged. But gradually, as the muscles strengthen, this thing will disappear. And by the time a child is 3 years of age, the child is walking properly. But what you are going to see, because of the postural alignment which is taking place, and gradually this alignment takes place over a few years, you will observe that these children are also knock-kneed. Knock-kneed is when, if a child is standing straight with both his feet together, what you will see is that there is going to be no space between both the knees. If there is no space between both the knees, then you say that person is knock-kneed, because normally by the time uh, this child will grow up, he will go into pre-pubertal years. This knock-kneed stage should finish, and due to the normal alignment of the pelvis and the final uh, rotation of the bones and bones of the legs, this knock knee should disappear, because technically, if an adult stands with his 2 feet together. He stands straight. Just see if there is approximation between both his knees. If there is space between his knees, then he is not knock-kneed. If there is no space between the knees, then he is a knock-kneed person. Because in knock-kneed person, that means that the alignment of the leg is not correct, and as time passes, as years pass, this puts a strain on our joints and muscles, and sometimes in later years, pain in the leg, in your knee or ankle or hip, those can develop because of slight misalignment of the limbs. But initially, this is a normal phenomena. A toddler will be bow-legged and knock-kneed. But the year as year passes, gradually the alignment of these bones, they will correct themselves, and they will become as they should in a normal adult. So with time, this bow these bow legs and the knock kneed effect, or both of these effects should disappear. If knock-knee effect is it does not disappear, we should follow it up, and we should correct the child that this process is corrected before that child reaches adulthood. Now let's look at 4 to 6 years of age. Here, primary ossification centers, they start appearing in the patella and in the carpal bones, and the height, again between 4 to 6 years, as we were discussing, the child suddenly, there is a growth spurt. Suddenly the height increases, and usually by this time, between these 3 to 4 years, a child grows by 5 to 6 centimeters per year. By the age of 6 years, what we see is that the primary teeth, they start to fall off, and permanent teeth, they start to come in. So your primary teeth, the temporary teeth, they start falling, and they are being replaced by permanent teeth. At the age of 3, nearly 75% of your bow-leggedness and knock-kneed, all of that has disappeared. So something which was there around 1, 2, or even 3 years, by the time a child has reached 6 or 7 years, these two things have automatically resolved due to the remodeling of realignment of the pelvic and lower extremity bones. Now we look at the pre-adolescence and adolescent stages. What are the musculoskeletal changes that occur in the pre-adolescent stage? If we look at the overall posture, if you look at a 6-year-old child, even if that child is a very thin child, what we see it's a very observant thing, that that child will have a protuberant abdomen. The abdomen will be protruding out, even for a very thin child, and there is going to be lordosis. By the time the child reaches 10 years of age, the spine has become more aligned as it should in adult life, and gradually this protruding abdomen and this lordosis, this will start disappearing, and the child's posture will start normalizing. This is the stage suddenly the limbs grow, and the child, if you look at the child, suddenly you see that he is all limbs. There are going to be long limbs, and he is going to be kind of disproportionate. Now, regarding the cartilage, obviously this is the stage, pre-adolescent stage. Again, this is the stage where there is a growth spurt. The child will suddenly start increasing in size, and this is the stage when the cartilage it gets start replacing by bone, and the epiphysis they start converting into bone. Now if you look at the females, 10 to 14 years of the 10 to 14 years is the age when the growth spurt is seen. This is the stage when they suddenly gain height, and for males this is between 12 sorry for females it is between 10 to 12 sorry 10 to 14 years, and in males it is between 12 to 14 years. But even we have seen that this growth spurt in males, it is even seen around 15 to 16 years in some cases, but usually around 14 to 15 years there is a sudden growth spurt. Suddenly they gain height. After that, till the age of 18 or 19, the height increases, but it increases at a very slow pace. So usually the nearly maximum height is gained by this time. After that, till 18 years, another 2 inches, maybe 3 inches, maybe 1.5 inch is added. But these years are the time when suddenly a child suddenly starts it, he gains height and suddenly he starts getting tall. Now in adolescence, now here is this is the stage when a child starts changing into a young adult. He starts becoming more mature. The features of adulthood they start appearing. In males, what you are going to see, their shoulders they start to broaden. Why do they broaden? Because of the growth of the clavicles. In females, what you are going to see, the width of the pelvis that will start to widen. Why? To facilitate childbirth in later years. You will see the facial muscles, you will see the facial features, they will start resembling more towards more like a adult. You will find maturity there. You will find that now the child is evolving into a young adult. So by this time, by adolescence, the linear growth, the height of a person has been attained, it has been completed. And at this stage, you will see a very young adult who has evolved from being a small baby into a mature young person. Now, these were the changes that we saw in the musculoskeletal system. Now, the thing is that there are a lot of musculoskeletal conditions that we have to deal with. And the key to their, you might say, to the key to their treatment, uh, the key to their prevention lies in early diagnosis. Now, the idea is to prevent the complications which might occur due to these musculoskeletal conditions, or if a certain musculoskeletal condition develops, the outcome that is related to that disease, how can that be delayed? Now, according to the outcome and the preventive measures, the musculoskeletal conditions they have been divided into three groups. First group is preferred practice pattern D, the other is pattern E, and the third is pattern F. Now, in all these three patterns, four conditions are definitely present. They are present in all these three patterns into which the musculoskeletal conditions are classified. Now, these four common conditions are: if there is impaired joint mobility, this is found in all three patterns. If there is impaired motor function, again, this point is found in all three categories. If there is impaired muscle function, and if there is impaired range of movement. These four conditions, these are common to all these three patterns. Now, the fifth condition which differentiates between these patterns, these are: if with all these conditions there is associated connective tissue dysfunction, then we put this musculoskeletal condition in pattern D. Now, with all those four findings, if these four findings are associated with localized inflammation, then we put this musculoskeletal condition in pattern E. And if with all these four findings, we see is there any reflex integrity associated with spinal disorders, then we put it in pattern F. Now, what do we mean by reflex integrity associated with spinal disorders? This means, like spinal disorders, these can be associated with musculoskeletal injuries. These can be associated with repetitive stress syndromes. These can be associated with low backaches. This can be associated with osteoporosis. So, all of these conditions, they are basically spinal disorders. So, what we see is that if there is some sort of a spinal disorder, any of these which have been mentioned, then is the neural pathway intact which is specific to a certain reflex. So, we are looking at the reflex integrity associated with spinal disorders. So, if any of these disorders are there, what you are looking for is the neural pathway to associated with the reflexes, are they intact or not. So this is the fifth finding. If we are dealing with this sort of musculoskeletal conditions, then we put it in pattern F. Now these three categories have been formed, and their preventive measures, their delaying tactics, their interventions, they have similarities according to the groups, and according to the groups they are managed. Now we'll see what are the typical changes which are associated with aging that we see in musculoskeletal system. First of all, in aging, we see there is decrease in muscle strength. And muscle strength is essential for postural alignment. If your muscles are good, they are in a healthy state, they have adequate strength, your posture is going to be good, your overall skeletal alignment is going to be good. But if your muscles are weak, they will not be able to maintain the normal posture, they will not be able to maintain normal alignment. And with age, as the muscle strength decreases, postural alignment, it also starts to suffer. Now, with age, muscle fibers type 2. There are two types of muscle fibers, type 1 and type 2. Type 1 are the slow twitch muscle fibers, type 2 are the fast twitch muscle fibers, which are needed for powerful abrupt movements. With age, there is a loss of type 2 fibers, and there is also loss of muscle mass. Loss of muscle mass in medical terminology is also known as sarcopenia. And as the physical activity decreases, the muscular system, it also becomes more dysfunctional. The more active you are, the more efficient your musculoskeletal system is. The more the less physical activity is there, the more ineffective your musculoskeletal system becomes. So, as your muscle mass decreases, it is further going to aggravate the disability, the inactivity of your musculoskeletal system. Now, the threshold of strength, what is that? That is equal to your independent functioning. So, we say that you have adequate muscle strength if you are able to perform your daily routine simple functions. And a very good test to gauge this is to look at the strength of your quadriceps muscles. Now quadriceps muscles are needed to rise from a chair to a standing position. If a person is independently able to rise from a chair to a standing position, that means his musculoskeletal system has adequate strength for independent functioning. This is the minimum threshold that a person must have. And as your musculoskeletal system deteriorates, obviously this is going to have an effect on your independent life, on your professional life, and you will start needing assistance even for your daily routines. Physiotherapist, here he plays a very important role because his exercise programs, his support, his knowledge is going to provide that essential muscular strength, which is again going to strengthen the muscles of the patient and again make him mobile for independent existence. Now, another thing that is going to be affected with age is your skeletal system. And what we see is that the axial skeletal system that is affected much earlier as compared to your peripheral skeletal system. So changes of age, they appear 5 to 10 years earlier in the axial skeletal system as compared to the peripheral skeletal system. And as age advances, there is loss of joint fluid, there is wear and tear of the joints and the muscles and the cartilage. Again, this further aggravates the efficiency and effectiveness of the musculoskeletal system. Now, weight bearing exercises, good nutrition, a good diet, and intake of calcium and vitamin D both in males and females, these things make a lot of difference. What if a person starts doing these things, what will happen, the advantages that he will have, the bone density which was rapidly decreasing, that rapid loss, that will reduce, even it might stop. The pathological fractures which might have occurred, yeah, which had occurred due to the decrease in bone density because of osteoporosis, those can be prevented. And as you take in calcium and vitamin D, it has been seen that it increases the bone density by 3% in 3 years. This varies from person to person. This is an average calculation. Now, if we look at the postural changes that occur due to aging, now as the person is getting old, obviously his muscles are getting weak. And with age, what we see is that the intervertebral discs, they start losing their water. Also, there is a deterioration which is occurring at a cellular level, and this deterioration causes flattening of these intervertebral discs. Also, with time, there is compression over the vertebrae. So, what happens is, due to the flattening of the intervertebral discs, due to the loss of water, due to the pressure of the vertebral bodies, the height of the vertebral column, it decreases, and that shows in the height of the person. You will observe that old people, as they get older, they their height becomes less. It is not something that the bones have shrunk or something has happened. It is this phenomena which has happened. The intervertebral disc, they flatten out. The water, it gets lost from the intervertebral disc, due to which the sponginess of the intervertebral disc is lost and it becomes thinned out. There is compression of the spinal column, due to which the height of the person, it gets decreased. Also, you will see that in older people there is rounding of the shoulders and there is kyphosis. This happens because the intrascapular muscles, they lose their strength, because it is the intrascapular muscles which pull the shoulders back. When they lose their strength, there is a rounding of the uh, shoulders. And also there is wedging of the thoracic vertebrae. So you will see that in old people there is rounding and they will lean forward. All this is because of the loss of strength in our various musculoskeletal uh, in our musculoskeletal system. So this is where we will end our lecture, and in our class we will discuss this, and any questions and queries we will put forward in our class. Thank you so much.